Okay, so one of the strongest risk factors for developing Barrett's esophagus, which is the only known precursor to esophagus cancer, is long-term acid reflux, also known as gastroesophageal reflux disease, or GERD, as it's more commonly referred to as. We generally think of long term as 5 years or more, but what's important to understand is that that's really including time both on and off medication. So, for example, if a patient has been on medications for 5 or more years to control their symptoms, that's considered long term GERD, even if their symptoms were controlled during that period. That just means that they've had the disease for 5 years and it necessitated medications. So that's the biggest risk factor when it comes to Barrett's esophagus. And however, there are other risk factors that we consider non-acid risk factors that should be important to acknowledge. So those risk factors are being of male sex, being above the age of 50, obesity, current or past history of smoking, non-Hispanic white race, and family history of esophagus cancer, especially in a first-degree relative. So having three or more of those is what makes the risk factors go up for Barrett's esophagus. When we talk about acid reflux, that's the largest risk factor, but your risk of developing Barrett's esophagus goes up incrementally as you have those additional risk factors as well. When it comes to esophagus cancer itself, the symptom that we usually are looking for are difficulty swallowing. So patients will commonly say that when they swallow, they feel like the food is getting stuck in their chest or they have to regurgitate the food back up. It's weight loss that's unintentional. So that means that you're losing weight, but you're not really trying to lose weight. It's coming off of you and you don't really understand why. And then also, if you get brand new acid reflux, that's just not going away, especially in later in life. So, for example, let's say you've never had acid reflux and you're age 40 or 50 and above, and then suddenly you're getting new acid reflux that you never dealt with before, and it's just not really going away. That can be another alarm feature that tells us that you may be having esophagus cancer.